Okay, for our next system, we're going to be looking at the OASIS archive, stats.oasisdataarchive.org. It's run by Interact for Health out of Cincinnati in collaboration with the Foundation for a Healthy Kentucky. So I can log in here. Anybody can log in, get the password and user agreement by going through here. But I'm going to log in here into the system. And now that I've logged into the system, just to let you know a little bit about what this website contains. This website contains all kinds of survey data. So in the United States, we have what's called the Behavior Risk Factor Surveillance System, or Behavior Risk Factor Surveillance Survey, or whatever you want to call it. It's got an acronym, BRFSS, BRFSS. I prefer to call it BRFSS. It is one of the large national surveys, along with the National Health and Nutritional Examination Survey, NHANES, which are done to gather information on the health of the entire U.S. population. Interact for Health, for at least this period from 2004 to 2009, was very active in doing those surveys for pretty much all the states surrounding Kentucky. And the data is able to be downloaded from there, and it's collected at the person level, whereas most of the BRFSS data that's collected and then the federal government aggregates it from all the states. The federal government can analyze it at the individual level, but it takes a little bit more effort to get that data individualized. As we will learn in the future classes, it is very powerful to have individual level data. It is far more powerful than ecologic or county level or state level type data, because the inferences that you can make are based upon things at the individual level, and it avoids what's called the ecologic fallacy, which you should have learned about. They continue to do the Kentucky and Ohio Health Issues poll, so you can see other information and polls that they've provided in here. But the Kentucky Health Issues poll, funded by the Foundation for Healthy Kentucky off of old tobacco settlement money, it's in here, and you can get frequencies of the survey. You can run logistic regression in the survey. All kinds of stuff. It runs SAS actually for you through this system, or you can download the data for SAS. You can then change it to a different format if you want. But if you want to see what's in there, we're going to just click on Codebook, and as we click on Codebook, it downloads the file over here, and you can access a lot of different survey questions and see what's contained within this one. So they've got questions about the health reform law, you know, some demographic questions and things like that. I'm not 100% sure what some of these other questions are that are on here. You can sometimes download the questions. You can also pick on the frequencies, and sometimes they've got you know, variable names like, are they in an Appalachian county or not? You know, all these different things. So we've got all these different questions in here, and you'd want to actually download the actual survey, which you can do, or you can actually look here, and here it is. It's asking about drug use. Do you know anybody in your family that's had these things? So if you were interested in doing a study trying to see whether or not certain populations in the state are, you know, more supportive of medical marijuana than other parts, or, you know, are they more supportive of recreational? What age groups are more supportive of it? You know, you can actually do the kind of research that allows you to predict or estimate the odds, so you could see, I guess, whether or not folks who are in poverty or folks who are from Appalachian Kentucky versus non-Appalachian Kentucky have a particular feeling about it. You can also look at their race and age, how they feel about it. So a lot of different things in here. They're also asking about, have you ever used an electronic cigarette or not? So a lot of good information in here if somebody was interested in doing e-cigarette research. Former smokers how do former smokers or people who are current smokers, you could pull some information in here, how they feel. What do you feel about firearms in the home? All kinds of stuff. This is just from the 2019 health issues poll. So if you need data and you need a topic, you can always go back and look at these different polls that are out here. So every year they do something different. And I know that I believe I've used the one from 2013 or 2014, which had some questions about bottled water use. So that's the health issues poll. If you are interested in looking at drug use, I'm not for sure, what population that is, if it's Kentucky, Ohio, Cincinnati, the United States, or what, but a lot of good data, and as they periodically get contracted to do stuff, new stuff, they do new stuff. You can also potentially download data from 1 year and compare it versus, a lot earlier and see how things have changed over time. So that's OASIS, which is run by Interact for Health, which also works with the Foundation for a Healthy Kentucky a lot to get Kentucky-specific health data. So that concludes this video on OASIS.